Hi, friends. Uh, it's great to connect back to discuss some more pertinent issues related to cancers in urology, uro-oncology. This month, as we all know, is celebrated as Movember month, in which we uh, we address issues regarding to men's health, pertaining to prostate cancer, testicular cancer, and men's suicide. Now, the aim of this uh, initiative is to create an awareness among all the patients about early detection of cancer, which leads to effective treatment, and that can also reduce preventable deaths. It also aims at spreading the message of detecting mental or psychological issues that men face in their daily lives, how to effectively know them early and get help. The main aim of this entire movement is to promote a healthy lifestyle. Along with it, we also want to promote annual health checkups, which help us to pick up many of these diseases in their early stage. Uh, it also promotes self-examinations, especially testicle examination, and the newer addition to this list of initiatives is the genetic analysis, which is available in your place, and it helps us to understand so much about your disease. Before I end, I want to focus on the three major areas as I discussed before, which is dealt with in this month of November. First is prostate cancer, in which we want to emphasize on the importance of screening. Is usually done after the age of 50 years, or we encourage people to do PSA testing when they have a lot of urinary problems, which are not getting relieved by any medication, and they have been there for a long time. PSA is nothing but a prostate-specific antigen, which is specific to prostate issues. It is organ-specific and not cancer-specific. So if you have a high PSA, that doesn't mean you have cancer every time, but it needs to be evaluated. PSA testing, as I just discussed with you, is important, and luckily it is done in all the executive health checkups, and we encourage you to do that as a part of your annual health checkups, which we also encourage to be done annually. We recommend it to be done 1 week after your birthday, so you don't forget it. If you have family history of prostate cancer, your father, brother, or your uncle has prostate cancer, or if your mother or your sister has breast cancer with a specific mutation, which can be easily detected nowadays, then you have a high risk of prostate cancer. That time you need to start screening yourself by doing serum PSA at an early age. In testicular cancer, we encourage you to do self-examination, which is a very low cost and easily done, zero cost in fact, and easily done examination, which any of the men can do when they're taking a bath. You have to use both your fingers to examine your testis, and just usually it is a very smooth surface organ. But if you find any irregularities in it or any bumps in it, then you can always get back to us, and we can help you out understand what it is. Remember, any irregularity in testes or felt when you are examining your testes doesn't mean it is cancer every time. Just get yourself evaluated and treated accordingly. Take early help. Men's suicide is increasing. In fact, it is said that parallel to corona pandemic, we have this mental health pandemic, which is very much in vogue, and it is not much focused on. Unfortunately, it is boiling down to our children as well. Talking about men's suicide, a lot of issues are there. People are facing economical, social, or personal issues which are leading to early suicides, and which has grown up exponentially, especially during this pandemic. We need to understand that if you have a feeling that things are not working out for you, try to know them early. Try to detect things early. and try to talking to people whom you know, whom you can seek advice from, your near and dear ones, your very close friends, your colleagues at your place. Please talk to them, so that you can seek early help. There is help available around the corner. Please take help. Don't take drastic steps which would affect your family after you're gone. Think about your family and take the right decisions. So, my friends, with this I end my brief, sound bite or info bite on Movember month. I hope you all comply with this and also spread the message to your near and dear ones. And if you are a healthcare professional, I hope you spread this message to your patients as well. Thank you very much.